on ancient medicine. The text explores the foundational aspects of medicine, highlighting its critical role in addressing health issues and its evolution as a field based on systematic knowledge rather than speculation. The argument begins with the assertion that discussing medicine without a solid grounding in its principles is misguided. The author emphasizes that medicine is vital during life's significant events, and without a firm knowledge base, practitioners would be equally unskilled, relying on chance rather than expertise. This leads to the observation that, unlike other arts and disciplines, there exists a marked difference in the skill and understanding of medical practitioners. Medicine does not require the elaborate hypotheses often used to explore unknown realms, such as celestial or subterranean phenomena, because it engages with tangible, practical matters. Claims in medicine can be evaluated based on observable treatment outcomes and the proficiency exhibited by those in the profession. The author points out that medicine has developed a solid foundation and methodology over time, resulting in numerous significant discoveries. The future holds promise for further advancements, provided that individuals with the requisite expertise build upon established knowledge, rather than attempting to bypass existing insights in an effort to claim new discoveries. This approach not only misleads others, but also undermines the integrity of the field. Transitioning into a deeper exploration of what constitutes medicine, the text emphasizes its role in addressing the ailments of the general public. It underscores the importance of discussing relatable topics, as everyday individuals are often concerned with understanding the origins, progressions, and resolutions of their health issues. While illiterate individuals may struggle to uncover these answers independently, when shared in relatable terms, they can connect with personal experiences, enabling comprehension. Therefore, effective communication in medicine requires catering to the public's understanding, avoiding complex hypotheses, and focusing on prevalent diseases. The evolution of medicine is further illustrated by examining the historical diet of humans. Initially, people consumed raw, unmixed foods similar to animals, which likely led to frequent illnesses and early mortality. This rough diet prompted a natural selection for individuals with stronger constitutions. To address these health challenges, humans began to innovate with their diets, discovering new foods that better aligned with human nature. Processes such as grinding, sifting, baking, boiling, and roasting transformed basic ingredients like wheat and barley into staples like bread and cake. This transformation allowed for a more balanced and suitable diet, promoting health and reducing the incidence of diseases. By refining food sources and improving dietary practices, humanity effectively laid the groundwork for what we now recognize as medicine. It emerged as a discipline aimed at replacing primitive dietary habits with sustainable nutrition to support growth, safety, and overall well-being. The author suggests that while some might argue whether this adaptation qualifies as an art, it requires significant effort, skill, and inquiry to develop effective practices. Additionally, the text addresses the ongoing exploration and enhancement of knowledge within medicine. As individuals delve further into physical training and nutrition, they often discover new insights that contribute to their strength and well-being. It reiterates that the essence of medicine lies in its dedication to benefiting the sick as established practitioners seek solutions to improve health outcomes. The document also critiques groups that do not engage with medicine, such as some barbaric societies and select Greeks who simply consume what they desire, regardless of their health status. In contrast, those who cultivated medicine aimed to achieve specific health goals, underlining the need for tailored dietary approaches. The initial strategies included reducing food intake for certain patients, which might have proven beneficial for some while being harmful to others. To accommodate individual needs, the invention of soups emerged, allowing for the dilution of strong ingredients to create gentler sustenance for those who could not tolerate solid food. The text stresses that even small amounts of solid food might exacerbate conditions for some individuals, while diluted soups could offer a safer alternative during illness. This nuanced approach showcases the necessity for a personalized understanding of health and nutrition in the practice of medicine. Ultimately, the author reinforces the idea that medicine is oriented toward fostering health and addressing the complexities of human ailments. The aim of the discipline has always been to refine and adapt methods that improve well-being, distinguishing it from a simplistic approach to diet and health. Thus, the need for medicine arises from the diversity of human experiences with illness and health, which vary significantly among individuals. In summary, the text presents a comprehensive view of medicine as a vital and evolving field dedicated to enhancing human health through knowledge, adaptation, and practical solutions. Its development arose from the necessity to address the inadequacies of early diets and the ailments they produced. As practitioners build upon established knowledge, the hope is for ongoing improvements in understanding human health, ensuring that advancements in medicine continue to benefit society as a whole. On airs, water, and places. The text explores the intricate connections between medicine and environmental factors, particularly focusing on how weather, location, and water quality influence health. It asserts that to comprehend medicine thoroughly, one must consider seasons, prevailing winds, and specific geological features of each region. The discussion begins with the importance of seasons, as each brings distinct health impacts. Winds, both hot and cold, play a crucial role, especially in how they interact with local climates. The qualities of water are similarly highlighted. Variations in taste, weight, and other properties can significantly affect health outcomes in different regions. Therefore, when visiting a new city, it's essential to understand its orientation to prevailing winds and sunlight, which can influence the climate and health conditions experienced there. In warm cities that experience hot winds and are sheltered from northern winds, the text indicates that water sources tend to be plentiful, but often salty and variable in temperature. Certain health issues arise in these areas, including heavy menstruation among women, difficulties with fertility and miscarriages, and susceptibility to convulsions in infants. The locals view some of these conditions, like epilepsy, as sacred, indicating cultural interpretations of health. Conversely, in colder locales, particularly those facing harsh winds during summer solstices and equinoxes, different health patterns emerge. Residents experience hard and cold bodily fluids, leading to conditions like constipation and vessel ruptures. Women, in particular, suffer from irritable menstrual symptoms, troubled childbirth, and challenges nursing due to the quality of local water. The text outlines the health implications of geographical positioning between summer and winter solstices, noting that cities with balanced climates tend to have milder diseases compared to those that face extreme temperatures and winds. Cities westward, shielded from eastern winds, often suffer from poor air quality, which can lead to health issues exacerbated by stagnant water, especially during summer. The author warns against the dangers of stagnant or marshy water, emphasizing that it can lead to various ailments like enlarged spleens and dropsies. The guidelines for selecting water are tailored to individual health needs, asserting that different waters possess unique properties that can adversely affect one's constitution if mismatched. Meteorological observations are crucial. Healthy seasons typically feature balanced weather patterns with rain in the autumn, mild winters, and hot summers lacking excess humidity. In stark contrast, dry and cold winters followed by severe summers can result in illnesses like dysenteries and fevers. The document posits that the natural environment can significantly affect the population's health, highlighting the distinctions between regions such as Asia and Europe. Asia is depicted as having a milder climate with richer natural resources and a more nurturing population compared to Europe. Thus, the text advocates for a more profound comprehension of environmental impacts, particularly through seasonal and geographic lenses, when studying health and diseases in different populations. Ultimately, the author emphasizes the need for a comprehensive understanding of how various environmental factors interact with human health, shaping different medical outcomes across regions. On prognosis. The text discusses the critical importance of predictive skills in the field of medicine, particularly regarding prognosis. Physicians who can accurately forecast a patient's condition and potential outcomes foster trust with their patients and families. This ability not only aids in treatment management, but also prepares physicians for the natural progression of diseases, allowing them to allocate their efforts wisely and understand when a situation may be beyond recovery or influenced by fate. Key indicators of patient prognosis are noted, emphasizing the significance of certain symptoms. For instance, if a disease progresses and manifests symptoms like eye discharge or concerning countenance around the third or fourth day, it may indicate a fatal outcome. Physicians observe peculiar behaviors during severe illnesses, such as patients waving their hands in front of their faces, which reflects a search for relief or comfort. Respiratory ease is described as a generally positive sign for patients suffering from acute illnesses like fever, which may resolve within 40 days. Conversely, symptoms such as localized cold sweats during acute fever are seen as ominous, potentially suggesting imminent death. The text warns against dropsies arising from acute diseases, deeming them unfavorable as they may not alleviate fever and can introduce pain or fatality. Other indicators of severe pain and a high mortality risk include retracted genitalia. The text also explores how changes in urine can signify illness severity. For example, thin and crude urine during recovery could point to looming complications like abdominal abscesses. The analysis of urine becomes essential, with particular colors and cloud patterns offering insight into recovery or deterioration. Additional symptoms, such as persistent chest or abdominal pain, despite other treatments, can suggest imminent suppuration or complication. Signs of a favorable prognosis include the patient's overall tolerance of their illness, effortless breathing, a warm body temperature, and regular patterns of urination, stool, sleep, and sweating. In contrast, unfavorable signs emerging around the 9th or 11th day, like labored breathing and strong thirst, reflect poor prognosis. A sensation of weight where pain previously existed may suggest the onset of suppuration. Certain symptoms indicative of empyema are detailed, including unrelenting fever, excessive perspiration, and lack of productive coughing. The text indicates that the likelihood of abscess rupture can be gauged by symptom severity, with severe presentations leading to rupture within approximately 20 days. Patients who swiftly recover after abscess rupture often experience an immediate resolution of symptoms, while those who do not typically show persistent fever and unrelenting malaise. The complexities of recovery from pneumonia and related abscesses are addressed, noting that persistent symptoms could still signal the development of complications. A hard, painful bladder, particularly amid persistent fever, indicates a grave prognosis. If urinary characteristics remain unchanged and persistent fever and pain are evident, this may foreshadow delirium or death. In summary, the text serves as a guide for physicians to interpret signs and symptoms in patient prognosis accurately. Understanding these indicators helps in effectively managing treatment and preparing for various potential outcomes, ultimately enhancing patient care and trust. On regimen in acute diseases. The text discusses the principles of treatment in acute diseases, particularly those described in the Canadian sentences. The authors provide accurate accounts of patient symptoms and outcomes, enabling even non-physicians to identify conditions through proper questioning. However, the text critiques their approach, noting that it often overlooks vital symptoms that physicians should recognize without patient input. The authors express strong disagreement with the limited treatment options advocated in these ancient texts, which focus primarily on drastic purgatives, whey and milk. They argue that even if these remedies were effective, which they contest, they are insufficient for the variety of complaints encountered in clinical practice. The text reflects on how modern interpretations of the sentences have offered more medical insights, yet significant gaps in guidance regarding regimen remain. A common misconception is highlighted: the notion that the simplicity of recalling medications like pitosan or hydromel can foster an illusion of competency in medical practice. The author emphasizes that any prescribed medication should be in proportion to the patient's usual diet to prevent adverse effects, particularly avoiding excess pitosan that could deplete the patient's strength. The text outlines specific recommendations for treatment adjustments based on the progression of the illness. For example, it suggests administering hydromel or wine before introducing pitosan if the patient exhibits dryness. The author warns against the consequences of consuming pitosan excessively or at inopportune times, which can hinder recovery and worsen respiratory issues. Oxymel is recommended for pain relief, while hydromel and water address thirst. Monitoring the patient's condition is crucial, with an emphasis on adjusting dosages according to their response. Should symptoms worsen or danger signs emerge, reducing the medication dose becomes paramount, particularly after the 7th day. The text also critiques the approach of some physicians who promote prolonged fasting prior to introducing fluids, as this sudden dietary change can induce negative effects, especially for patients with specific conditions. The author provides practical insights into how dietary changes and fluid intake must be handled cautiously. Sudden alterations, such as switching from regular consumption of wine or water to entirely new beverages, can lead to digestive discomfort, bloating, or even severe symptoms like delirium or respiratory distress. The discussion culminates in illustrating how incorrect dietary restrictions can have damaging consequences, especially when acute symptoms are present. Distinguishing between various types of beverages, the author identifies the specific effects of sweet and darker wines on the body. While sweet wine is noted for inducing bowel movements, it can also lead to liver and spleen swelling. Conversely, darker wines may aid bowel health but can harm the upper digestive system if used excessively. In conclusion, the text advocates for a more nuanced understanding of treatment methods in acute diseases. It underscores the importance of personalized care, emphasizing that rigid dietary rules and improper timing can lead to detrimental outcomes for patients. The discussion stresses the need for careful monitoring and adjustments in treatment plans to address individual patient needs effectively. Book I of the Epidemic. The text outlines a historical account of various epidemics, detailing the symptoms, experiences, and outcomes of several patients suffering from acute fevers in phasis, particularly around the autumnal equinox. The seasons during this period were noted for mild weather, characterized by consistent rains and soft winds during autumn and winter, aiding the spread of illness through more hospitable conditions. Patients typically presented with a variety of symptoms, including continuous fevers, which were described as having no full remission but fluctuating in intensity, leading to difficult to manage health conditions. Common symptoms also included constant sweating, cold extremities, resistant to warming, and gastrointestinal disturbances marked by frequent and pungent bowel movements. The narrative portrayed a pattern of illness that varied in intensity, with some patients suffering from relentless fever and chills, often associated with delirium, thirst, and severe discomfort. A notable observation pointed to the periodicities of these fevers, categorized into various forms, including semi-tertian, tertian, quartan, quintan, septan, and nonan fevers. The differences among these fever types were characterized by their respective cycles and symptoms, presenting a crucial aspect of the illness's progression. One prominent case is Philiscus, who fell ill on the first day with acute fever. His symptoms escalated quickly, starting with bilious stools and black urine, leading to insomnia and ultimately resulting in his death by the mid-6th day. His deterioration involved a gradual increase in severity, including a cessation of bowel movements and urine output due to the intense fever. Philiscus's condition reflected the trajectory of many patients who appeared to suffer a rapid decline over a matter of days, often culminating in death. Another patient, Hierophon, also presented with a severe acute fever, but took a somewhat different course. Hierophon experienced insomnia, dark and thin urine, with notable swelling of the spleen and abdominal distension. After experiencing a crisis on the 9th day, his condition fluctuated with relapses and periods of slight recovery, fluctuating between fever and symptoms such as deafness and painful urination. Cleonactides' case presented an interesting progression marked by irregular fevers and debilitating headaches. His symptoms included fatigue and varying paroxysms of the fever, with periods of relative relief followed by the intensification of symptoms such as vomiting of bile. Observations made during his illness highlighted the complexity of fever management and the interpretation of symptoms that accompanied these paroxysms. By the 60th day, he showed signs of improvement, with well-coloured urine and an absence of fever, but experienced a recurrence of acute symptoms later, particularly a severe nosebleed and subsequent crisis. This narrative captures the grim realities faced by individuals during an epidemic outbreak, detailing not only the clinical aspects of their illnesses, but also the psychological toll, such as the distress related to fevers, delirium, and the inevitability of death. The interplay of various factors in the progression of these illnesses reveals a profound complexity, highlighting the unpredictability of fevers and their varying manifestations across different individuals. Additionally, the text reflects on the social and medical understanding of illness during this historical context. Physicians observed and recorded these symptoms to make sense of the fever patterns. The detailed account serves as an early glimpse into the experiences of epidemics, showcasing the methodologies of documentation and patient observation that scholars and healers utilized to outline the phenomena of illness long before modern medicine had developed standardized practices. The structure of the narrative emphasizes both the clinical symptoms and the palpable emotional weight carried by patients and individuals surrounding them. The experiences, though rooted in a specific historical and geographical context, resonate with larger themes of human vulnerability in the face of illness, social response to health crises, and the ongoing quest for medical understanding. In essence, this text serves both as a medical account of an epidemic and a somber reminder of human mortality and the often unpredictable nature of disease. It portrays not only the bodily experiences of the afflicted, but also reflects on the broader societal implications of living through epidemics, underlining the continual battle between life and death, hope and despair in the face of overwhelming illness. Through these intricate narratives, we can glean insights into the complexities of historical epidemics and the human experiences that shape our understanding of health, illness, and survival. On injuries of the head. In the discussion of head injuries, significant attention is given to the anatomy of the skull, how its structure affects injury response, and the assessment of damage when trauma occurs. The shape of an individual's skull can vary considerably, influencing the arrangement of suture lines, which are the natural seams in the skull bones. These lines change based on the presence of bony prominences at the front or back of the head. For instance, if a prominence is located at the front, the sutures resemble the Greek letter tau, T, while a posterior prominence alters the appearance to resemble the reverse of ta. If both prominences exist, the sutures take on the shape of the letter eta E. One critical aspect discussed is the healing process of posterior head wounds, where pus formation is delayed due to the bone's thickness. This often results in higher survival rates for injuries at the back of the head. However, when a suture becomes exposed due to an open wound, it represents one of the weakest points for resistance against external forces, making it particularly vulnerable to weapon strike. When evaluating injuries, several types of bone injuries are categorized. A broken bone in the skull is likely to cause contusions at the fracture site and surrounding areas, even if a fracture does not occur. Contusions can arise without visible fractures immediately after the injury. An important element of skull injuries is the possibility that a significant force can create indentations, fractures, or depressions in various combinations, leading to a classification of injuries into 4 distinct modes. Assessment of an injured skull sometimes requires an evaluation of parts of the bone that are not visibly damaged. Injuries at the suture lines can complicate diagnosis, as these areas are naturally weaker and may not clearly show fractures or contusions. This complexity necessitates careful inquiry about the circumstances of the injury and a detailed inspection of the damaged area. In cases where bones are exposed, there may be a need for surgical intervention, particularly if bone condition can't be clearly assessed from the surface. An incision may be required to expose the bone for a thorough evaluation. The method of evaluation involves scraping the bone with a raspberry to reveal any hidden fractures or contusions. The scraping should be done carefully, following the natural lines of the sutures for accurate assessment. The text also addresses the treatment steps when a fracture is suspected. If there is a visible indentation or damage from a weapon, appropriate cleansing of the wound is the first step, followed by scraping to further reveal the extent of any damage. Distinct areas on the bone surface may indicate the presence of fractures and contusions, guiding necessary medical interventions. In conclusion, the text serves as a detailed guide for assessing and treating head wounds, emphasizing the need for careful examination of skull injuries due to the complexities of bone structure and injury type. Understanding how to evaluate and treat these injuries is crucial in medical practice, as it directly impacts patient outcomes and recovery from traumatic head injuries.